When the weather gets nicer, like the first day of spring, you just feel like moving. And then you think, wait a minute, my joints are giving me a lot of pain. You do not have to sit and suffer through that. Dr. Bill Cimikoski is joining us now. He's from Utah Stem Cells Joint Treatment and Wellness Center. It's good to see you.
Thank you very much, Misha. Great to be here.
What kind of help can you give our viewers if they're feeling pain?
Well, you know, it's funny that a lot of times the winters come and they go and we start to get excited about the spring. And then all of a sudden we remember, hey, wait a minute, that mountain biking I like to do, the running I used to do, I've got sore knees, a bad hip, a sore shoulder. A lot of people are giving up on a lot of sports they like to play. Softball, for instance, tennis, even golf can be tough on the body at a certain point. And one of my most rewarding and favorite things to do is be able to keep people doing all those things that they still enjoy doing. And a lot of people think that they need to give up on these sports and these activities as they age. Arthritis starts to catch up with them. That's a big problem for a lot of people. And now with the use of stem cells and platelets, we use platelet-rich plasma and stem cells that we get from umbilical cords and from amniotic membrane. These stem cells can regenerate and heal damaged tissue and keep people enjoying all the sports they love to do and all the activities they want to do.
Are you injecting those stem cells right into that tissue wherever you may be feeling the pain?
Exactly. So what your body's trying to do is keep up with the wearing and tearing down of the arthritis or the cartilage as you age. We all get arthritis. The question is, some people get pain from arthritis and some people don't. At a certain point, you reach a tipping point where that wearing down of the cartilage starts to bother you. And your body is trying to send stem cells, which are the cells that become your new cartilage, and platelets that have all the growth and healing factors. It's trying to keep up with the damage on its own. But when it can't send enough of that tissue, send enough of those cells to repair the tissue, that's where I come in. I can inject directly into the joints stem cells and platelets and give a much more higher quantity and quality of stem cells than what your body will deliver. And so you have a great chance of an excellent recovery.
And then your body's regenerating and helping itself. What areas are we talking about that are most commonly treated, and who needs this? Who benefits from this?
Well, my most common joint that I treat is the knees, because the knees are a weight-bearing joint and is poorly constructed, and a lot of people get trouble with arthritis as they age. So that's my most common joint. But I also treat a lot of shoulders, lower backs, necks. Virtually any joint in the body can be treated. I also treat a lot of hips. So a lot of people have been told they need a knee replacement or a hip replacement. And you don't have to do that anymore. If you're thinking about getting a knee replacement or hip replacement, stop and come see me. The consultations are always free, and I've been able to help so many people recover significantly from the arthritis or tendonitis or other structural problems and not have to have these types of drastic surgeries.
Well, and there's so much downtime in those surgeries. How much is the downtime for this?
Well, the nice thing is that the procedure itself only takes about 1 hour to do a single joint. And you'll be able to walk out of the office right after it. You'll be able to get on with your normal activities. There's a little bit of increased pain for 1 or 2 days. I provide pain medications for that, but there's virtually no downtime. The only thing you have to do is be a little patient. It takes about 5 weeks to get most of the improvement and healing. You do all your normal activities during that time, but I'm going to ask you not to go out and run a marathon or do those really tough, vigorous sports for just about 5 weeks. And then that's when I see you back. That's when you get a lot of the improvement. And that's a really rewarding time for me to see those people back at that time.
Well, if you have questions, now's the time to ask those. Utah Stem Cell Therapy. All the information is right there on your screen, along with the phone number. You can go to utahstemcells.com or our website for all of that information. Don't let another day go by. Be ready for this spring and summer. Thank you so much, Doctor.
Thank you, Misha.
We'll be right back with weather, everybody.